we started the company actually as a question and answer service. I mentioned we didn't have video codecs when we first started the company. We started a text-based question and answer service. And I reached out to doctors and gave them the opportunity to help people by answering their questions. We actually didn't charge people to ask a question that we would show to the doctors. We also didn't pay the doctors to give answers. We were actually told we were out of our minds to ask doctors to give answers to patient questions without being able to pay for them. But it turns out that doctors are actually interested in understanding and helping people and learning in the process. So we developed a question and answer service, which is still live on HealthTap. You can go there today and ask a question. You'll see it's already been asked and the answers are already there. And the answers that are there have been peer reviewed by other doctors. We create an environment that allows doctors to share their knowledge with each other and with patients. That service has collected nearly 100,000 U.S. licensed doctors who've signed up to participate, and we've so far collected about 3 million answers written by doctors to questions. What that means is there's now a library that exists for people to get answers from their questions from their doctors. You mentioned continuing education. One of the features that we've seen, one of the behaviors of the doctors, is they're using our platform to try and improve their knowledge. But they're improving it in ways that are relevant to the things that people care about. So if someone asks a question and a doctor doesn't know the answer, the doctor says, well, this is an opportunity to learn the answer. One of the things we did on the platform, we built the technology to make it possible for the doctor to say, I want to learn about the topics of this question. So you can say, I want to learn about this by clicking the box. And we run a search of Medline into a PubMed search and show the doctor in real time journal articles related to the topics of the question. The doctor can refine the query and do investigation and search and read about the answers to generate the knowledge to be able to give a better answer for their patients. And on HealthTap, the doctor generates continuing education credits by simply filling out asking for it by clicking the button to say, yes, I'd like to claim CE credit for this, and here's how much time I spent doing it. So doctors have access to unlimited Category 1 CME on HealthTap through the process of answering questions. As I say, we've had some very prolific doctors who have taken it as a challenge anytime they don't know the answer to a question to go learn about it and improve their medical knowledge.